Okay, so treatment for these depressive and bipolar type disorders. About half of individuals diagnosed receive treatment. Treatment can be very successful. There's some differences among racial and ethnic groups. Obviously, groups that are disenfranchised or underrepresented or underinsured struggle to get adequate treatment and reliable treatment and consistent treatment. Depression is, as we've mentioned many times before, frequently seen with other disorders, and it is responsible for much of the therapy that's being done in today's psychiatric and psychological community. So the cognitive behavioral therapies do seem to be very effective. We will talk more about medication and using these therapies with medication and how that generally results in the best outcomes. Behavioral therapy and cognitive therapy look to identify the problematic styles of thinking and behaviors that can exacerbate the symptoms of depression, and look to change some of those behaviors and replace them with more positive ways of thinking and more positive behaviors. So increasing enjoyable activities, many times things, simple things like increasing or encouraging the client to increase physical activity, exercise, social activities that they enjoy, and working to replace some of the thought process patterns from a negative pattern into a more positive pattern. In particular with adults who receive these therapies, and in particular when they're done effectively or done properly and reliably, individuals can show improvement. Up to 50% or 60% of individuals show significant improvement in their symptoms and in their quality of everyday life. So that's a real positive in terms of treatment. There are some sort of new ideas about working with depression in particular. Some styles of therapy will use, in addition to cognitive behavioral therapies, mindfulness training, meditation, other types of prayer or mindfulness meditation. And again, sometimes this can incorporate exercise and other things like that. Improvements have been made on culturally sensitive therapies to help assist individuals in some of the minority groups to specialize that therapy for some of the individual cultures. Family therapy is also very beneficial. And this can apply to all sorts of family systems, multi-generational families. Family therapy and couples therapy has been shown to be very beneficial in improving those relationships, which many times can be part of the individual's day-to-day struggles with their disorder. So some of the biological treatments or the medication treatments for unipolar depression or major depression, formerly known as major depression, the MAO inhibitors were developed back in the 1950s. It's a relatively old type of medication that's not really widely used. They can be effective, but there can be some very serious side effects. It can be extremely dangerous, particularly for blood pressure when individuals ingest certain types of food. And if I remember properly, parsley is one of them, and chocolate. So individuals have to avoid those foods altogether, which can be very difficult. So they're not really the first line of therapy. The tricyclics were developed later, and they work more specifically on the neurotransmitters believed to be involved in depression. they block the reuptake of those neurotransmitters in the nerve cell, in the synapse between the nerve cells. And we have a picture here that I'll go back to. Some of these, many of these medications do have side effects. Some of them can be pretty undesirable, and they should not be ended quickly. So individuals need to be monitored pretty carefully on these tricyclic and what we'll talk about next, the second generation antidepressants. But if you see here, if you remember again from intro to psych, these are two nerve cells. These are the dendrites and the receiving neuron. The neurotransmitters, remember, those chemical messengers that travel across this synaptic gap into the receiving neuron, and then they are reuptaken into the sending neuron. The medication blocks that reuptake so that there's more serotonin, norepinephrine in the system, and that has been shown to be beneficial for individuals suffering from these depressive symptoms. So the newer second generation antidepressants, also called selective serotonin reuptake inhibitors, and again, just what that means is that it inhibits the reuptake of this serotonin back into the sending neuron. They are different from the MAO inhibitors and the tricyclics. They still do have side effects, as many medications do. They are lesser and typically more easily tolerated than the older antidepressants. But they are not an all or nothing solution to these unipolar depressions. Generally, the best benefit comes from use of these antidepressant medications in conjunction with other types of therapy, specifically psychotherapy, group therapy, family therapy, new age therapy, those types of things. So there is some concern that the positive studies related to antidepressants have been more highlighted in publications. And so a greater review of all of the data in research regarding these antidepressants probably puts their effectiveness closer to 30 to 40%. Again, that if the medication is well tolerated and there is some benefit, if you can add in other types of therapies, such as talk therapy, group therapy, other types of support, that can improve the outcome for the individual. So there are some biological approaches which involve brain stimulation. So we'll talk just briefly about electroconvulsive therapy, vagus nerve stimulation, transcranial magnetic stimulation, and deep brain stimulation. Generally, these are used after other options have been exhausted. So after medications have been tried, after therapy has been tried, many times individuals are still under the treatment of those types of therapy, or a psychiatrist or a psychologist. And if those treatments aren't successful or are not resulting in a significant enough improvement, these therapies may be used in conjunction. Electroconvulsive therapy is extremely controversial. Again, it should be used as a last resort or after other measures have been tried. Patients need to be fully aware of what the side effects of ECT therapy is. Most commonly, individuals experience memory loss after the procedure. This can be permanent. Most of the memories do return. But it does seem to be very effective at alleviating some of the types of depression that have not responded well to more traditional styles of therapy. So the procedure has been modified a little bit and improved. Again, patients will experience most likely some memory loss. but there is a significant improvement seen in some individuals. So again, informed consent is extremely important for these patients. They need to know what the risks are of this therapy. Vagus nerve stimulation is actually surgically implanted and sends electrical signals to the brain. It has been shown to be effective at reducing depressive symptoms in some patients. And again, it's rather traumatic to have a surgical procedure such as this. So other options should be explored first. Transcranial brain stimulation and deep brain stimulation also has been shown to reduce depressive symptoms in individuals. It's again not the most commonly, and certainly not the first line of treatment in individuals with depression, but it has been effective for some individuals. So again, cognitive behavioral therapy, interpersonal therapy, and biological therapies used together generally have the most effective results. So that combination of talk therapy, whether it's couple therapy, family therapy, individual therapy, group therapy, and if necessary, drug therapy, seems to have the best options. Typically, medication therapy will only be effective as long as the individual takes that medication, whereas talk therapy, group therapy, couples therapy, that sort of thing, after therapy is stopped, there is still some residual effect. Some individuals like to do check-ins after that, sort of a maintenance of that psychotherapy, but you don't see the same decrease in benefit that you see with medication therapy. Medication is not effective for psychological disorders after you stop taking the medication. So bipolar disorders were not very good treatment options for bipolar disorders until the 1970s, when lithium was developed and approved for the use of bipolar disorder. It's extremely important, extremely effective in treating bipolar disorders. It's a mood stabilizer. It reduces the highs of mania and hypomania and tends to lessen the depressive symptoms a little bit. It helps to stabilize the person's mood. Some individuals with bipolar disorder also may require an antidepressant, but again, it's correct dosage and correct medication use can take time to establish with each individual patient. Lithium is extremely effective, as are the other mood stabilizers. Most individuals report an improvement. It is not uncommon for individuals to not like taking the mood stabilizing drugs, because while the depressive episodes are very miserable and uncomfortable, the manic episodes, particularly in the beginning, are for many individuals an enjoyable state of being, and they can be very productive and very creative, and lithium and the other mood stabilizers kind of flattens all that out. And also, like many other medications, sometimes people will say, I'm doing very well, I don't need this medication anymore, and that can result in a relapse or a reoccurrence of some of their severe symptoms. Adding psychotherapy, talk therapy, in particular family therapy or couples therapy, to get family support, in particular for bipolar disorder, seems to be very important. It's not uncommon for individuals around the person, close to the person, to be able to recognize, in particular, a manic episode as the individual's mania is increasing. It's very common for family members to notice this pretty easily, and if there already is a good relationship established, and many times therapy can help with this, the individual can get readjusted or back onto their medication program more quickly.